So these are the first questions. 35-year-old male, formerly a heroin abuser, has been on methadone maintenance for the last 13 months. 2 weeks ago, he had a positive tuberculosis skin test, that is PPD test, and a chest radiograph showed evidence of right upper lobe infection. That means that he has a TB or LTBI. He was started on standard 4-drug antimycobacterial therapy, so he has TB, active TB. He has come to the emergency department complaining of withdrawal symptoms. Which of the following antimycobacterial drugs is likely to have caused these patients' acute withdrawal reaction? What do you think, Bushra? Baha, what do you think?
Yes, sir.
What do you think is the right? So is ethambutol, isoniazid, pyrazinamide, rifampin, or streptomycin?
Is C.
C. Pyrazinamide. Baha, what do you
Yeah.
think?
I think it should be D2.
So if you look at this picture, one moment. So if you look at this picture, you see here methadone. That is the opioid agonist. So this is very very close to the morphine and heroin. Heroin is also from the same group, and this is male is actually a drug abuser. Do you know what is a drug abuser? Baha.
Hello,
Do you know what is a drug abuser?
hello. Can you hear me?
Yes, I can hear you.
Hello.
Baha, what
شنو
is the
المشكلة؟
drug abuser?
بشرى جاي تسمعين المدرس ما جاي يسمعه.
Baha, do you know what is a narcoman?
Hello, can you hear me?
Yes, I can hear you.
Yes now. Yes sir, say what?
Do you know what is a
What was the question?
drug abuser?
It is like
Narcoman.
getting high.
Yes,
It is
getting
like
high.
getting high.
Yes,
Yes.
correct. Do you
Did you
know?
get high ever, sir?
So,
Yes, I know it.
so the most commonly drug use is heroin.
Yes.
So it's injected in the vein. So like,
But I thought that it is crystal. The crystal they are use it usually. No, not me. I didn't use it ever.
so
But there is too much situation now in the world. They are using the crystal because it's easy to get it and even to make it.
okay, but still now not about the how to make it, but actually this is abuser, and he's switched to the methadone as a replacement for the heroin. So because he cannot stop heroin fast because of the withdrawal symptom. So he is taking methadone, and look on this slide. Here you can see that the methadone is,
It is in the pancreas or what? This is the pancreas?
sorry?
It's liver.
Yes, it's liver. So
Liver, liver,
because
liver,
all
liver.
these
Sorry.
drugs are metabolized in the liver, including methadone, and rifampin increases the metabolism, and that is why methadone is metabolized faster, and this patient feels withdrawal symptoms because methadone is not anymore in his body. So I think it's D rifampin. So let's see. Yes, it is. It's D rifampin. So like you just to remember this slide. So and the methadone actually uh, will last less because of the hepatic clearance, because it's increased by the rifampin. So it's shortened. The duration of action of methadone is shorter, and then increases the withdrawal symptoms. So that means that these patients have to take methadone of more frequently when he is starting rifampin. So others will not induce. Isoniazid will decrease, vice versa. So like this rifampin is isoniazid will decrease, is minus, and rifampin increase. Please remember that. Okay, then here is HIV patient that is with a tuberculosis, or he takes the HIV antivirus medicines that include two drugs protease inhibitors and two nucleoside reverse transcriptase inhibitors, NRTIs, that actually we will study next classes. So he already takes 4 drugs. So actually here is very complex. So correct is B because rifabutin is recommended for the in patients with the HIV. So because it's less induces the of the liver enzymes than rifampin. So rifampin that was in previous case is inducer, while the rifabutin is less inducer. That is why this is standard combination like isoniazid pyrazinamide and ethambutol. Usually rifampin is used, but for HIV patient it's replaced by rifabutin. And actually all other these two are not standard. These are second line. Like moxifloxacin is a fluoroquinolone, and streptomycin is also antibiotic, so, and amikacin also. So these are second line agents. So okay, then so for the leprosy, so someone joined here. Hola, welcome back. So for the,
Sorry, I don't know what happened, but I'm losing my contact
that's no
twice
problem.
or
I'm recording everything, so watch
okay,
on my
thanks.
YouTube channel. So
Okay, thanks.
and also subscribe to my YouTube channel. Baha, uh, have you invited someone to subscribe to my YouTube channel?
Yes, I did invite one of my friends, but I don't know if they are saw it or not yet.
Okay, so
I wasn't home the last week. I had a surgery. I have a surgery. Sorry.
how is your surgery?
It wasn't for me. It was for my uncle. He have a bawasir.
What he has what? What is disease of your uncle?
Hemorrhoid Oh, this fuck. Uh, Hemorrhoids.
Okay,
Hemorrhoids.
hemorrhoids. Okay, good. So there are medicines for that disease too. So we will study them.
Yes, yes, everybody know it.
So I will ask you.
Just he is an overwhelmed and he needs somebody to help him. So I traveled with him to another city.
Okay,
It was
I
a
am very
hard
glad.
week.
I am very glad. Have you take him by car?
Thank you. No, no, no. It was by Samalot,
But by
a
plane?
flat,
By
the
plane.
Iraqi air flat.
Okay.
Yes.
So the leprosis is actually uh, they see that you remember that clofazamine can cause skin discoloration over time. So this connected with the mechanism of action. So others are not correct uh, because peripheral neuropathy is not peripheral, it's neuropathy, is central neuropathy. And uh, erythemonodosum is uh, actually decreases. So the risk of the erythemonodosum not increases, it decreases in patients with that is given the clofazamine. So yes, the discoloration is not harmful and then it's reversible. But reverse is several months or years, but still complete reverse. So and then the last question is about the uh, tuberculosis after the starting of the treatment. So this is standard treatment for the tuberculosis, first line therapy. Um, so he has a eye disease. So decline in the vision is optic neuritis. So this is actually always ethambutol. So we forget about that during the lecture, but still this is one of the adverse effects of the ethambutol. Uh, most important adverse effects actually. And so fortunately the adverse effect is reversible and ethambutol should be discontinued uh, very fast. So uh, with the first signs, and usually patients with that are treated with a ethambutol should be checked, their vision should be checked regularly with the ophthalmologist. So these are a tuberculosis treatment. So what are your questions about that?
No question.
No questions? So have you done the tests?
Yes, I done my first and second. I passed, but my third one I didn't pass it. It was more difficult for me, and also I am trying to review my mistake. I can't even review my mistake.
Okay, and what, like, do you remember something, questions that you are uh, not sure about?
Actually, no.
No, you don't remember
I
questions?
was no, I was making it before, maybe 4 days ago, and also I can't review my mistake. I can't open it. I can't know which one is mistake,
Okay,
and
so
I can't repeat it again.
okay,
Also,
uh, let's do that. Like, let's all of you please make the test, the third test, and then I will look on your mistakes and I will select common mistakes and then we will discuss them. Okay?
okay. Can I make it again? Can I try to make it
Not
again?
yet. First, we will
Not yet.
make a
Okay.
discussion with the mistakes so you don't make them again. Because if you make it again, then same mistakes, you will remember your mistakes. That's not good.
Okay, okay.
So
But if we can like see our review, just like 1 hour.
I will show you your review with explanation. So, but
Okay,
please,
this
um,
is good.
all of you make the test so I can see what mistakes are common, what are not.
Okay, I will do it,
Uh,
inshallah.
and also
Okay,
Mustafa make it too. So and
okay.
then we
Where is
can.
Mustafa, by the way?
He
ايه
was
ده؟
here, left.
He has problem in network on
Okay,
network.
that's fine.
Yes,
Maybe
I
with
he
will.
have
contact.
a problem like my uncle
He's
to
recorded, so
about here.
watch online. So if no questions, then I think we can conclude. Uh,
Can you please open for us test number 4?
Test number 4 is not ready yet. First, let's.
Okay.
Uh, I want all of you to pass the third test first, so you can focus on the fourth test. And
Okay, okay. Can you please just send us the link for the test number 3?
okay,
It is sent it already.
It's
Yeah.
just hard for me to sing in the website and find it. My internet is so bad here, so
one
it's like I
moment.
need it directly,
I
please.
will. I will send. One moment.
Okay, thank you. I appreciate that.
So, but Baha, there is one trick. Uh, to be
What
able
three?
to pass to start the third test, this is the link. Do you see in the chart?
Yes, yes.
So, to be able to start this test, you have to
Mm-hmm.
complete test number first. First one.
I think I did it. Yes.
No, you don't.
Okay, I will do all of them. Can you please just send me the link for test number 1 and 2? I already read the information I and the
Okay,
lectures.
this is that for the first test, and you have to pass it with the score 70 or higher. Okay, so before starting
Okay,
So
test,
if I couldn't pass it in the first time, can I get another chance?
no,
No. So how can I pass it? With, maybe if I couldn't pass it for 70 the first time, what should I do?
you should try to pass it above 70. And I see that
Okay.
you don't pass it, so you don't try it. So that is why.
Okay, I will try to pass it
But
now.
before trying it, you should
Uh-huh.
watch lectures, read the chapter, and only then try to. And when you pass it,
Yes, I read the chapters.
please don't just try to select randomly. It will not work.
No, no, no. I know that. This is only Ala. She's doing these things. I don't do these things. It's haram.
Okay, so I'm glad you don't.
Thank you, sir.
So
So
good luck.
have a good day, bro.
Uh,
Sir, sorry.
Good luck in the
Thank
test.
you.
And if you need additional
Uh huh.
lectures, there will be lectures soon on the central nervous system because we we passing it with the third
Camera
year
مفتوح.
students now, and you can find
Yes.
them at in my YouTube channel.
Okay, bye
Okay.
bye.
Okay, see you
It's
next week.
good.
See you
Thank you.
later.
Bye.
My
Hello,
See
pleasure.
you
hello.
See
next
you.
week. Bye bye.
الله يسلمك.